They're a group of healthcare professionals building personal relationships with many vulnerable patients and their families. And some community health workers think it's about time more people have access to their services. Community health workers spend time helping patients get access to some critical quality of life services, but you won't find them across all health systems. Good evening, everybody. I'm Kimberly Gill.
And I'm Damon Fernandez. Right now, the state of Michigan and some hospital systems are working to change access to this public health service, hoping it could bring some relief to many people. Take a look. Navigating the healthcare system can be tough for some families.
She is such a fighter.
Especially when you or a loved one is medically vulnerable, like Genevieve Hale's mom, Michelle Harmon.
Such a strong-willed little feisty woman.
Genevieve's mom was diagnosed with lung cancer about 1.5 years ago. Harmon's being treated at Henry Ford Cancer Institute. For the family, that road has been challenging.
Dealing with this kind of stuff, you got to be the rock. You can't cry. You can't let a lot of emotion show because there's people looking to you for strength.
It was at Henry Ford Health Brigida Harris Cancer Pavilion where Genevieve and her mom
How your mom been feeling?
first met community health workers like Verlicia Dixon.
We provide community resources.
Dixon describes community health workers as part of the team's critical circle of support, helping patients navigate their treatment plans and connecting them to a variety of resources like transportation, paying bills, emergency housing, financial education, and emotional support, among other things.
Some people just need art therapy, somebody to talk to. Sometimes I've had patients call me up and just want to talk.
You won't find community health workers like Dixon across all health systems, but the state of Michigan is working to change that. This year, the state's Department of Health and Human Services expanded Medicaid coverage to include community health worker services. Now, because health systems could be reimbursed for some of the cost of these professionals, they're optimistic the potential for hiring more community health workers could be likely.
I'm excited about it because with government support, that means we'll have maybe access to more resources that we can provide for patients.
Henry Ford Health has been working toward expanding patient access to community health workers since 2014. It's a service Genevieve and her family say is making a difference.
It feels like I can breathe now, that there's somebody else besides me that I can go to for help.
Now, if you're unsure whether your health system has community health workers or patient advocates on staff, Dixon suggests you start by simply asking your care provider and also seeing if it's a resource they're considering.